Today we are joined by our first guest to Pearl's Dental Podcast, Dr. David Johnson. Dave is an accomplished dental officer with 20 years expertise treating special care adults and children. He has a wide range of skills to treat special care patients, from general anaesthetic and sedation to cognitive behavioural therapy. Outside of work, Dave lectures nationally on the use of acupuncture within dentistry as an adjunct to treatment and a means of pain and anxiety control, which is actually how we met. And when we had a request to cover special care dentistry, I couldn't think of anyone better to ask to join us for this conversation. He has published journal articles on research within the field of paediatric dentistry and dental acupuncture. When not lecturing, he promotes and works with Bridge to Aid, a dental charity providing vital dental pain relief training and for healthcare workers to deliver sustainable dentistry in the developing world. He is the current chair of the BDA Welsh Council and has been a chairman of the Welsh Committee for Community Dentistry, and we are very lucky to have him here in the practice with us today. Welcome, Dave.
Welcome, Dave.
Thank you.
So, Dave, how was your week?
Yep, the infamous question. Yeah, it was a really good week. It was just one of those weeks where all of the denture try-ins were just right, and a chrome partial I put in, just that lovely soft click, and just everything was just right. I did a couple of assessments, new assessments on special needs kids and special needs adults with additional learning needs, and then a large proportion was spent treating under sedation, mainly inhalation sedation, and it was just really good. The week just had flow to it, and to top it off, outside of doing the clinical work, I got to invite my friend Jazz Galati of the Protrusive podcast, and he came and spoke to my DCTs about diagnosing and managing and the treatment of temporomandibular joint disorder. So
I saw the pictures that Jazz came to you, and I was thinking, why didn't we get speakers like that when we were DF ones? Amazing.
I think it can come down to who you've made friends with along your journey. So it's not being out there, giving courses myself. You get to meet some other great speakers, and Jazz had asked me previously to go and speak to a load of his protruserati, so it was great to bring him to Wales. It was a shame he arrived a bit late. He had a late clinic, so we met up for breakfast, and was able to give him a few gifts for the kids and stuff like that. Cool. But and then to top it off, we're here today, so it's nice to join the two of you. It's one of those things where you phone in, long time listener, first time here. But it's great. So it's nice, and it's nice to be able to, for myself, to be able to ask Ali, how was your week?
Oh, thanks, Dave. I had a good week, but a busy week. No, I didn't this time. No, I had to say it. I just got back from Kenya, so we took my little one back to see where I grew up, and it's been 8 years since I visited Nairobi, which is where I grew up, and it's a completely different place. So it was a really cool experience, actually, and I saw it through different eyes and got to revisit some memories, so that was awesome. But I'd promised I'm going to switch off for 2 weeks, and I didn't, and it was great because I got loads done. But if you don't mind, Flo, I need to plug a few things now because I didn't realize what's coming up, and it's been so long since it feels like we were here every week recording for season 1, and now there's guests for season 2, which is awesome.
Fantastic.
Which we get to speak to our good friends and some of the top people in dentistry. It's such a privilege to have you here, Dave. Really, I know I don't even know how we know each other, to be honest.
I think it's through the podcast. Honestly, I think it's me writing in and just saying things and us talking about it, because just awesome. Picking up some of the tips you've spoken about. The biggest one, and it's outside of dentistry, was that nuts and seeds on your cereal in the morning. On your cereal, it made a difference. I'd like to think that I'm healthier because of it.
I got one more for you now, if that's okay.
Yeah.
Is the so we talked about you knew about all of this, Flo. You do your research, but we learned about this on a growth day last year, and they talked about electrolytes as part of your breakfast as well. And I was taking these electrolytes that you get off Amazon, which Flo told me about because she uses them for her running. But actually, in terms of hydrating, I was reading about how there's a few types of salt that have a lot of the minerals that you can't get anywhere else. So I've been putting 1/8 of a teaspoon of Celtic sea salt in some water in the morning, 10 minutes before I have my breakfast. And that has made such a difference, to rehydrate before you put in all the seeds and nuts and fruit and stuff. So
I'll try it. It might be a more difficult one.
It
Yeah.
doesn't. You don't taste the salt, but
Well, that's as long as you don't taste it,
No.
that'll be all right.
I mean, I know that's
Just
what we're
drinking
here.
seawater.
That's what I thought it would be like. But yeah, brilliant. But the things that I need to plug, if that's okay, got a really cool webinar coming up thanks to W&H on ISQ. So for implant people, implant stability quotient, and it's something that I didn't really understand until I started using the device to measure this. So they're doing a free webinar with Dental Update on the 6th of June, so in a couple of weeks' time, and that's at 7 p.m. So sign up for that if you're interested or if you want to demystify that. Then on the 29th of June, thanks to Darren Kelsey Lab, who we work with, we do all our full arch work with Darren, at the Southwest Dentistry Show, giving a talk on how we plan and execute our full arch surgery digitally. And it means that everything's really seamless. And it's thanks to Darren, we've worked on this protocol together. So we're holding nothing back and just sharing everything because it could improve the patient experience and outcomes for everyone. So that'll be really cool. I've launched a course with my friend Abdul Osman. Dates haven't come out yet, but it's on immediate implants, and it's for beginner to intermediate implant dentists who want to start taking teeth out and putting implants in at the same time. And there's many good reasons to do this. So the registration for that has opened, so you can see that on Instagram is the link. And finally, sorry, one last one. I'm about to launch a more advanced implant course with Gareth Jones, who's based in Monmouth. Do you know him, Dave?
No, I have heard of him,
Yeah.
but I don't know him.
Incredible surgeon, Mr. Protocol. He's been on courses all around the world, and the coolest thing about Gareth is when he goes on courses, he comes back and he implements things to the T, which I love. His work is phenomenal. So we're launching a site-specific implant course, so a few types of different implants which are made for specific situations, so more advanced. And that's on the 18th and 19th of October. It's hands-on and lectures at the Celtic Manor. So that's in South Wales for anyone who wishes to travel. Registration hasn't opened, but keep your eye out and save the dates. And so these are the things that I've been working on over the last couple of weeks.
Well, you've been busy.
It's been busy. How's your week been, Flo?
I've also, had a busy week. I was actually at where we went to our growth day this morning. I did some mountain yoga, which was
Cool.
lovely. And I recently started another new practice. So I've just been settling in and getting to my feet in that new one as well, which is, it's been very, very productive. A little bit different, I think, wherever you go, but it's great sort of having that experience. I feel like I'm getting very good at starting new jobs.
So you're in 3 practices. I should add there, but it's your choice, not because you keep getting kicked out of practices. So you're in 3 practices now. Mm-hmm. How do you find it having your week where you're going between one and the other? Do you find it difficult to switch hats, or do you like doing it?
I really like having being between different places. I think what's quite nice is you can, if there's something going on in one place, you can sort of switch off from it and then go, okay, I'm at the next place, and you can just sort of focus on it. I think in an ideal world, maybe 2 would be easier to manage, but actually I'm really liking the split at the moment. It's working really well, which is good.
If you find your week goes really quickly, because I've been in different clinics for the community, and you can be covering sometimes when other people are off. And at one point I might have been on a 5-day week in 6 different locations. The week just went so fast.
Yeah. No, it definitely feels like it's going, definitely a lot quicker because of that. But actually, yes, we are here to chat all things community and special care. As per usual, I have found a tiny little brief online for what they are. And interesting, I didn't actually sort of know the difference between them, but community dentistry is officially called the Salaried Primary Dental Care Service in England and Wales. And it's the managed service where dentists have sort of a contract of employment to fulfill services standards to meet. And they're salaried, and they can do sort of domiciliary visits, mobile surgeries, and they utilise sedation for anxious patients. But compared to the special care dentistry, which is a team that provides comprehensive care for patients aged 16 years and older with a wide range of complex additional needs that seriously affect the provisions of dental care.
So sorry, what's the difference between those two?
I'm going to hand that to
Between
you, Dave.
special care dentistry is a speciality within dentistry. Community dental is a service which originates from the school dental service. And when I started over 2 decades ago, it was still, most of my work was mainly on little kids, little fillings, and there was a small amount of special care dentistry within it, mainly special care adults, and you see some special care kids. Now we're more throughout Wales, and that's where I've primarily practiced. We're a referral basis only. Okay, there are 7 health boards in Wales. Each of them has their own community dental service. There are differences between each, because in one they may do a little bit of prison dentistry, in others, if they're more rural, they may do a little bit more of general dental surgery. There may not be a large district general in that area, so they may offer, the community dental service may offer the specialist oral surgery or specialist endodontics. But primarily, it's now more referral basis only, special needs kids, special needs adults, sedation, general anaesthetic, domiciliaries. I do a clinic once a week treating patients from a forensic mental health hospital, so they're brought over securely over to me, and I see them, and they're generally detained under the Mental Health Act, or also by the Ministry of Justice, and I'm doing dentistry on them. So it varies from area to area.
So there's a bit of overlap, but those are actually two completely different terms.
Generally, our main thing is from the Welsh Health Circular, because I'm going to speak from a Welsh point of view, is we treat the most vulnerable. That's our broadest, but that's a very broad term. That's a very broad term.
So what sort of further training did you have to sort of do to get into that?
Well, when I qualified in 2001, there was no speciality in special care dentistry. A lot of the other specialities had only just been created, and people were grandfathering into them. And there was some training places. My background is more paediatric dentistry. That's why I came into community. If I wind back the whole clock, I qualified in 2001, so I'm the 3rd generation in your 2 generations. So I bring the average age of the podcast a little bit higher. So I qualified 2001 and did VT, general practice in North Devon. I was really lucky. I went into a practice where there were 3 very experienced general practitioners doing mixed practice, who, being their first VT, they had no idea what to teach me, so they just taught me everything.
Brilliant.
It was just fabulous. It was really good. And the foundation that they gave me just took me on from there. I'd spent 25 years of my life always in a city, so I went up to North Devon. And it was lovely being in a rural environment. I'd seen that Castaway 2000 with Ben Fogle. Thought that would be really great. Let's head out into the country, and it was a great time. But I realised that I needed to be back into the city. So I moved back to Cardiff to do general professional training, which we now call DCT. So it's your 2nd year. In fact, the house I was in is only about 5 minutes walk from your practice here. And I did 6 months in community, and then 6 months in oral surgery. So that gave me a bit of hospital dentistry, a bit of community. And I got to the point where it's like that crossroads in my life of, I really did like pediatric dentistry, but I also really did like oral medicine. Both of them seemed a little bit more complex for different reasons. But at that point, you had to do medicine to go into oral medicine. And I thought, I want to get out into the real world. I don't want to go back and be an undergraduate. So 20 years ago, I went into community 4 days a week, but still retained being 1 day a week a clinical lecturer in oral medicine, and it's just progressed since then. But at that point, it was mainly little kids, little fillings, and some special care. Now, I don't get to do any of the little kids, little fillings. I do kids with additional needs, adults with additional needs, and additional needs can be anything: medical, physical, emotional. My main basis is and a lot of my week I'm either assessing, or I'm treating, or occasionally teaching under sedation or general anaesthetic. So if the gases that I use aren't good enough, then we can go to the hospital, and my anaesthetic colleagues have got far better gases and far better drugs. So the main thing is just taking it so that the patient can basically accept the treatment that we're trying to do. Yeah.
Do you get sort of more time then for that because of the additional needs in
Yeah,
checkups and things?
it is very rare. It is very rare. I would think, I see what people have in private practice, and I see what they have in NHS practice for checkups, and I don't think we have, a huge increase on that. But what sometimes, and it happened, once this week and once a couple of weeks ago, a child who it was taking a little bit longer, and I didn't want them to. So, a child with additional needs on the autistic spectrum, non-verbal. I do a lot of checkups using a toothbrush because they're used to having a toothbrush in their mouth, and it may not be safe for me to use a mirror. I use loops and a light, so I've got good visuals, and I'm going around brushing their teeth, but they may be finding that, distressing. It is, it's strange having someone come at you with a toothbrush who you may have met before, you may have seen them a few times before, so sometimes we try and get the parents to do it, and I'm looking in, but if I think that it might tip the child over a little bit more and we're not going to get that full checkup done, then we might get them back 2 weeks later, just so I can build up that full picture. But it's very rare that I need to do that. So generally I get it in the amount of time. There's just using a few tricks.
Sorry, Dave, I've got to ask two questions. One, what would kind of the reception team typically book in for you for a checkup? And then two, would you always have the availability in your diary to be able to bring that little one back next week, or does that take some shuffling?
No, sometimes there's odd gaps,
Okay.
where we've had cancellations and stuff like that.
Okay.
But it may be, a few weeks. Maximum it's going to be is a month. But yeah, for an assessment, so not a checkup, assessment as in a new patient. So with additional needs and stuff like, because a lot of that is information gathering
Yes.
at that point. So we get in our service 40 minutes.
Okay.
Oh.
So it's not a huge amount of time. And it does help, there are protocols that make things a little bit speedier by if they filled in medical history beforehand. But sometimes if they haven't, and then there's a lot of medications, but yeah.
So obviously you said about how you got into it. If someone wanted to apply for special care dentistry sort of now, what system do they have to sort of go through?
So for special care dentistry, it would be, the community would be a great place to start getting yourself a foundation. So, it's something you're going to get from doing a DCT1 position. So, a lot of DCT1 positions, so your second year, following on from your foundation training, that's going to give you 6 months in community, 6 months in one of the specialities within a hospital. And then on from that, there's other core training years, so DCT2 and DCT3, and some of those are solely in the hospital. And that's going to involve, restorative dentistry, special care dentistry. But some of them, and we have them with us, are solely a whole year with us in community to maybe pick up some more experience in paediatric and special care dentistry. Because if you're wanting to take it on as a full career, then you need your DCT1 and DCT2 at least before you move on to your specialist training pathway.
Okay.
But if, like me, I just, you'd apply for community to work out, as you would apply for other practices. And often, like with certain practices, the jobs aren't being advertised, but there's some capacity. Someone may have left and there's, 2 days going. So I always say to people when they contact me is just phone around, email around, and speak to the clinical directors. There may be a little bit of capacity.
That's great advice. So
Yeah,
you're
yeah,
saying if this is your passion and you want to get into
Yeah,
community, then start getting in touch with people.
Well, more and more now as well. Was we used to have people, like me, who came fully into community, but we're seeing more and more from Flo's generation that they're combining working in the community with working in general practice, whether that be NHS or private.
We're seeing that a lot with
yeah.
our referrers and with some of your friends and stuff. Yeah,
We've got dentists working with us who do a couple of days with us, and some of them are in NHS practice, and some of them, are in a private practice.
So, Dave, what would you put that trend down to?
I think it's wanting to, they're still early on in their career, and I think they're wanting to experience more things. Within community, because we're salaried, then you have that sort of like buffer of having a salaried income. alongside what you're earning in general practice, which may fluctuate. Maybe that they're not wanting to put all their eggs in one basket,
Yeah.
but it's because of the variety of what we offer,
Yeah.
and what they can do with us.
Do you think there's an element of, maybe this is a bit controversial, but it feels like because of the way the NHS system is in terms of in general practice, maybe there's less of a sense of giving back to the community by being in an NHS practice, and that community's giving people that sense of giving back, perhaps?
I think no matter who you're treating, you're always giving back. You're always improving healthcare, whether it's NHS, private, or in the salaried service, or in the hospital. I think you're always giving back. There is that, that altruistic thing of doing it. But I think it's hard to say without someone actually surveying them, all and finding, there'll be individual reasons for individual dentists. But I think giving them that broad base, that maybe they want to go. I've got friends of mine who qualified, when I qualified, who spent years out in general practice and have recently come into community because they've decided that's the way they want to go. They just wanted to, especially when they really enjoy sedation and enjoy oral surgery. That's something that we do quite a bit of, especially in special care dentistry.
Would you say that's sort of what you do most of then? Sort of if you were ranking what procedures you do sort of the most of?
For me personally, yeah. Recently I had a bit of time off work last year, and I'd unfortunately broken my leg. So in that time that I got to sit and reflect and listen to podcasts whilst enjoying the glorious sunny weather that there was, it got me thinking about the things that I really enjoy. And the things that I really enjoy are working under sedation, under general anaesthetic, and then sort of like education and leadership. And that's how I got into. I was lucky that at that point, the training program director job came up, and I applied for that. But
so that kind of came to you. That this hasn't been a 10-year plan. This is something that, because you had time off and you thought about it, you realized how passionate you are about it, and that's what's taken you to the role you're in now.
Yeah, I think I was just lucky that what I was already doing was mainly sedation and general anaesthetic. And then teaching, not having a formal role apart from within our health board. I'm a STAC approved teacher for sedation, so I supervise other dentists and nurses sedation courses, which is great because it helps us build up our sedation base within our service, so more and more people can do it, and if more and more people can do it, then hopefully we can get the waiting list down. But it means that we can offer it in more locations, so patients don't have to travel so much. So I've always done that, and I've always lectured on acupuncture, again, for near 20 years, but this is a more formal educational role. So it was just, I don't know, that sunny day sitting in the park, just thinking what I enjoy. Sometimes it's, I think I've learned more from listening to podcasts like Jazz and yourself about being more focused about, what you enjoy and really designing your practice. I think I've just been very lucky that things have come along, and the way that the service has developed. I've been in Bridgend for 18 years, and in that time our clinic has been under the control of 3 different health boards. So we've 2P'd, which is transfer of undertakings, protection of employment. So me and my staff, we've 2P'd over. So we started with Cardiff and Vale, we 2P'd over to Swansea, and that was great because I got to have a new mentor, which was our specialist at the time, who then became a consultant, a guy called David Davis, he was just great to work under. He was just absolutely phenomenal. So, and it was at that point, around 12 years ago, that I really got into special care dentistry as opposed to paediatric dentistry, which, having done 10 years of paediatric dentistry, the kids have got older and they've become adults. I've just got older and less hairy on my head and grown a beard. But so it's a natural thing, and it's quite nice because when the kids grow up, in community we do it really well. We're transitional services. They don't have to go from us doing paediatrics to us doing special care, as may happen in teaching hospitals. They just transition through with us. So I'm more than happy to keep seeing them. It's great.
That was one of the questions I was going to ask, because I know definitely in lots of other services in medicine, there's a bit of an issue nowadays with, you get great care in that pediatric thing, and then they get to that 16, 17, and suddenly they're lost in the system. So actually, if it is that transition, that's so like wonderful to sort of hear.
You've really got to start it on lectures that I've been on, setting up transitional care within dental hospitals and stuff like that. You've really got to start it early. In Sydney and Melbourne, they start it around 14. And you have one of those meetings where the dentist who is going to treat you and the dentist who does treat you, they're all together. So it's a bit like a MDT. It's a nice introduction and getting used. We can't just go 16 and then you're off in another room. That's not the way. There needs to be that sort of like blending just over. And that's what the places do it well in Sydney and Melbourne. And the lectures I've heard from their paediatric specialists there, that's how they've really done it, and it works quite well. The only thing that really put a ride to that recently was the global pandemic. But apart from that, the intention was always there.
So in terms of sort of if you're a GDP and you do have some sort of a harder to treat patient, what sort of signs or flags or things like that would you say this is when you should be referring them over to community or special care?
So anyone who's generally not able to access dental care within a general practice for whatever, physical, so most of our practices are ground floor, so we've got wheelchair access, we've got wider doors. In Bridgend we will be eventually getting a newer surgery. So ours is just like one of your ground floor surgeries with what we call a break leg chair, which isn't one of the ones that the leg's already out, so it's easier to transfer from wheelchairs. In certain clinics we have bariatric chairs, we have wheelchair tippers, so anyone for sort of a physical need, there's that, and then there's the more complex medical, but not such things such as, in the olden days, you might be referred someone in because they're on warfarin. Well, that can easily be handled in the practice. Same with some of the novel anticoagulants. We used to occasionally receive referrals, and that the patient or their parent will be told, oh, well, the community have got more time. Yeah, but I don't think that's a very good reason, because I think we can find time within general practice. But yeah, anytime there's no real red flag, but anytime that we're there for anyone who's finding it a little bit more difficult to access dental care within general practice.
Can I ask, Dave, do you get a lot of referrals for people who need oral surgery under IV bisphosphonates? Or do they tend to go to MaxFax?
No, we get bisphosphonate referrals in.
Yeah. And are you performing those then?
Yeah, I can do it. But I feel that I don't think it's that complex. I feel that it can be done in general practice. I think a lot of it comes down to explanation with the patient, good surgical technique, to try and make it as least traumatic as possible, but also going over the consent. Yeah. Because sometimes, some of the courses are, if it's going to happen, it's going to happen. Yeah. And then close monitoring of it. But I think the main thing is just explaining, if the tooth can't be saved and all you can do is extract, then you're going to have to extract.
I'm glad you said that. I'm only asking because more and more we're getting referrals for people to have teeth removed under IV bisphosphonates. And of course, we'll worry about it because the consequences can be big. But the reason I asked you is because if you said, oh yeah, we put them in the hyperbaric chamber and then the MaxFax consultant comes down, it's not. It's something that you're doing, taking care, but it's something that can be done out in primary care. It's interesting that we treat them, because if we don't treat people who are on these medications, who will? We liaise with oncologists and cardiologists if we need to, things like that. But that's why I was asking.
Yeah, no, we treat, and so sometimes for certain things, my mum was on IV bisphosphonates and she got referred into the dental hospital, and the dentist who was taking out the teeth did it in the way that I'd have done it. They were her upper 6 and 7. He sectioned them. Yeah. And then took them out in the least traumatic way possible. So, that, but explaining, the biggest thing is explaining to the patients that this could happen. We're going to keep an eye on it. We'll monitor you. And if you do notice anything, so you tell them what to look out for. And if that does happen, what you're going to do. And it's that point, that's when we would send on to our colleagues in MaxFax. But the initial management, we handle ourselves. And I think, it could easily be handled in in general practice, I don't often have much in the way of special skills and superpowers. I just, approach it, by the protocols that are laid out for us.
Yeah, makes sense.
Sure you do, Superman Dave. So if you do have sort of those more anxious patients that we all get there, do you have any sort of like tips and tricks or phrases that you really like using sort of to help calm people down?
Again, I think a lot of it comes down to the assessment, and I'm going to steal a phrase that my friend Jazz says, that the mystery is in the history. So taking a good history, finding out why they're anxious, and it could be they have needle phobia, perceived needle phobia. Maybe they've had a bad procedure, or maybe it's a certain procedure. Some people are happy to have a filling, but the thought of that extraction, or if it's a more complex extraction, it could be that. So they could have been hurt, or the fear of being hurt, and then on from that, the fear that if it does hurt, you're not going to stop. So I think good communication. So I say a lot to my patients. I lay down rules that are for me, that I like to do. If any time, I'm constantly monitoring them, and if at any time I think they're not comfy, I will stop. And I often say, there's that big sign, the red one, that's on, it's got 8 sides and it's got 4-letter word on it. Stop. I said, that's what I will do. Yeah. And then we'll find out what the problem is, see how we can get over it. But it's when, and I've seen cases where unfortunately that hasn't happened, and the patients lost confidence, lost trust, and the dentist has lost the patient. Yeah. And that's a shame. That's a shame. And sometimes it can be something simple, like they just needed a little bit more local and a little bit more time for that local to work. Yeah.
It's funny, it seems like there's a big overlap between being a good community dentist and being a good private dentist. And I say private dentist because basically people are choosing where they're going to spend their money and go to. And actually what people don't realize, I've met a lot of young dentists who go, oh, I'm not good enough for this yet. Well, I hope you're talking about your communication, not necessarily technical skills, because actually it comes down to that person being comfortable. And it seems like actually these two worlds seem so far apart between community and kind of providing maybe high-end cosmetic treatment, but they're not really. It's the consent and making sure someone feels looked after and they're comfortable.
Yeah, we know that communication is the biggest thing. And the same with treating any anxious patient is, over a time, you'll notice that a patient, that when they built up that relationship with you, that trust with you, and especially if you're someone who's gone from one practice to another, and one of your 3 practices, you may have just come in where someone else was for a bit of time, and they go, oh, I was just getting to know Dr. A, and they were really, I knew them because they talk about their kids and stuff like that. That's the thing. They're the things so I love chatting with my patients. Whilst I'm basically, I don't see what I do as ever being a job or employment. What I do is I get to chat with a great group of people and their patients, their parents, their carers, and I like the intricate work of dentistry, so it's like just doing a hobby, and the radio's on, and I've got a nurse there, so I get to chat with them. It's like, it couldn't get any better, to be honest. Yeah.
I have a feeling you're an extrovert.
What gave you that?
So one of the techniques I know that you use with anxious patients is acupuncture, which was how I met you, and it's definitely been something that I've been doing a little bit more of. Do you think this is a useful skill for sort of all GDPs to have?
Yeah.
Sorry, can I just add that Flo acupunctured herself when we did a cornectomy on her, and it seems to have worked wonders. So really cool. And actually,
and she's still chilled out now.
I know.
Yeah, and I've never seen it in action, acupuncture, and it was really cool to see.
It is really good. It's one of those things when it's you can get some patients who, even though they're needle phobic, but that can be that can be just for intraoral injections. So something extraorally, like the stating points on the top of the head, just it's just amazing when it works. When I was on oral medicine, you'd go back, and in Cardiff, that it's open units, so so it can be a bit busy on the clinic, and yet people would sometimes near fall asleep on the clinic. But it's really good. I got into it 20 years ago when I was a GPT, a half-day course with a consultant in anaesthetics, And I responded really well to it, and I was like, "Oh, this makes me feel amazing. I need to learn more about this." So I went to that, that mystical place where you think you'll learn about acupuncture, the far off land, and that was Sheffield. And I spent some time with a consultant in medical acupuncture, and because it's one of those things that's a little bit different, it's a little bit. Not that everyone does. You get asked to do courses and stuff like that, and it just spiraled from there. And I've been teaching practical courses for about 16 years for the British Dental Acupuncture Society. But yeah, for not just dentists, but DCPs, we have a huge amount of hygienists and therapists come along. The three main things that you're really going to use it day to day in practice would be anxiolysis, so relaxing your patients. So it's really good. And it can be used in combination with sedation for a synergistic effect. Gag reflex, if you use it for one thing and one thing alone, gag reflex is just phenomenal, and that's why we get a lot of hygienists and therapists coming along. And then temporomandibular joint pain, so muscular, so from masseters and temporalis, just really good for that. You see patients and I see dentists on the courses with needles in their masseters, and they just feel, you can just see the relief they haven't had. When you've had that muscle ache for so long, it's just great. So we teach it as a society just to get more dentists and DCPs within the profession teaching it. We are the British Dental Acupuncture Society, but we have people fly in from across Europe. Even post-Brexit, we've had people come in from across Europe, North America. One guy even flew in, it was 2015. I'd arranged a course in London during the Rugby World Cup weekend, because I was hoping that Wales would make it through to the final, but we unfortunately didn't. Australia did. And there was a guy called Peter who'd flown in from Australia. I was like, are you in for the rugby and see friends? I said, no one's teaching it over there. So, he flew in on the Friday, did the weekend course, and then flew back out.
How cool is that?
But he was like, that's only a flight. I was like, it's a big compliment for someone to
That's awesome.
come that far. I swear there's got to be someone in Australia. If not, if anyone's out there, I'm happy to have a flight out there.
Well, there you go. If anyone's listening in Australia, I think people would fly you out there. I'm just not sure people would listen to us from across the world. So this probably isn't the medium to find that, but really cool. I have to say, Flo was really complimentary of the course, and I think the biggest compliment for any course is that someone uses the techniques afterwards, because it's not just understanding the technical side and the applications for it. It's being inspired to use it, and really cool.
And that's a nice thing, because the delegates on the course, they get to practice on each other, so it's not for needle phobics, and you see the delegates there often sat there just feeling a bit chilled out, and it's
it was the one in the centre there that for me, I was just like, wow.
So are you going home every evening after a hard day, and instead of having a glass of wine, you're just sticking needles in?
Genuinely, I've done it a few times where I've had a bit of a headache come on, and I've just popped a few in, and it just goes.
It's nice.
Wow.
It's also good
It's
for
amazing.
clearing the sinuses as well. Just anything congestion, really good for that.
That's what
Dave,
I was
when's your next
offering
course?
to you the
This
other
is
day.
awesome. When's your next course?
Next course that the society is running, I think it's either 18th, 19th. I think it's 19th, 20th of October, and it's at Regent's College Conference Centre in London. And if you want to find the course, if you just typed into Google dental acupuncture, generally, the British Dental Acupuncture Society will come up as the top search there. If not, Google British Dental Acupuncture Society, and then go through to courses for professionals.
Cool.
It's a weekend course, mainly taught by myself and my good friend Dr. Tom Thayer, who's he's retired and returned, which is the best sort of work. That's a topic you need to get someone on to talk about.
Yeah.
He's
That's actually a great idea.
yeah, he's a great idea. He's a retired oral surgeon. He's up in Liverpool, and again, he's an educationalist. So we approach it from that point of view.
Cool.
And it's great. It's lovely teaching with someone else. It's really, and hopefully the delegates see that we enjoy it. And that's why we do it.
Yeah.
It's just great fun.
Awesome.
Well, you've definitely got a lot of hats going on. How, and it's something that we're both very passionate about. How do you balance that sort of then work-life balance when you're doing sort of all of this?
I think it's just having a supportive family, because when you see someone that, who's got, so there are lots of things to do, but it's also it's making sure that you timetable time for yourself and timetable time for the family. Doing this podcast worked out really well because my boys at Scout Camp for the weekend, and my wife and my daughter have driven up to North Wales for the Earth Eisteddfod that starts tomorrow. So it's like, well, I've got a free evening. Save watching a load of rubbish TV.
Perfect.
Let's do something, so it was ideal. So the dates that Flo gave. So sometimes, other times early on in my career, I wasn't the best at it. So I think, having a significant other and then the kids come along, and that's something that really grounds you. You realise, if I'm staying late, then I'm having time away from them. So it's finding a balance between all the different things that there are, but and also having time for me. It's something I've recently seen, and I've put it on most of my emails, a little thing that even though I'm sending this email at this time, this works really well for me, but please respond in your own time. So this morning I got up, was making a cup of tea whilst that was brewing. I could do a couple of emails. That was it. That was me done for the day. But I just felt that I needed to do them. They were in the back of my mind. I wanted to get them done, but then I knew Monday's free, Tuesday I've got a bit of work. I've got some work to do. But
That's a really nice thing to put on there, actually.
Yeah,
I like
it's
that.
not mine. I saw it on that great educational Instagram in the sky.
Yeah.
Some real
Knowledge is not owned. That's
and
fine.
there are some great things on it. I changed my my composite polishing profile due to seeing what some other dentists were doing.
Yeah.
So I love that thing. There's certain things, you don't want to go down that spiraling hole of just watching this different, but certain they're great. I love the fact that there's this free exchange. It's another thing for that free exchange of ideas and protocols, and it's just those extra things, that extra 5%.
Yeah.
You just keep putting those extra 5% in places. It just really makes a difference. And when you hear other people, this was from Mike Gray, who's over in Abergavenny, and he talking about, so again, just where you just reach out to someone and go, talk me through your polishing protocol, and it's like,
and people who teach want to teach. So I think, in my opinion, there's fewer people who are saving the stuff for the teaching gigs come on my course, and there's more people who are really happy for you to reach out, and more people filming what they're doing and putting it out there on socials, which is really cool. I used to wish YouTube was around when I was a student. Now I wish Instagram was around, but I'm starting to think maybe I am a different generation to you then, Flo.
No, I do. I think it's amazing. I love the fact that nowadays, if you're doing a procedure or something that maybe you've not done as many of, or you've not done for a while, you can go on YouTube and find something.
Yeah.
And it just refreshes everything.
Well, now that we've started filming more and more of our surgeries, and with our patients' consent, we can put it out there. It's for professionals to see. And I get messages from all around the world. Like small things like, oh, you use that for that, or where did you get that? And you realize that actually if we all do that for each other, and we can message them across the world, and the progression is just going to be incredible now, because there's this pool of information out there and people are sharing. It's
I think that's how we started talking, because there was that red sort of like silicone thing that you use for resting your tools on, and I was like, that really looks like one of those grease-free baking tray things that you can use. Is that what it is? Because I just like the fact that it was, again, it's one of those little things that can make a difference. Or someone goes, oh, when I'm doing this, I find this instrument, it's not expensive, or something like that, or I use, and I think that's how.
I think you're right. I have to credit Farhan Ahmed for that, because that's part of his course that I did was, here's the things you need, and it was the silicone oven tray or oven sheet, because it's non-slip and it can be autoclaved, and you can almost use the patient as a table. Although that then progressed, because I realized, oh, this is a slippery slope, because now I want everything in front of me. So we've now got a Mayo table, a surgical table. So that's now something we don't use, but actually that saved my back twisting around. So that was how we talked. And so what a nice thing that this thing that is shared, and I think that the key here is not to share things, it's to feel free to ask questions about things that are shared. That's how we make connections, right? By asking questions.
Yeah, and that's one of the nicest things about my new role being a training program director for the DCTs, because they're just sponges. There's just so much they want to learn, and there's things that they know that I don't, because they've experienced from different teachers, different dental schools, things that so it's great. But again, it's that whole pot of sharing things. So when you hear them discussing things, especially with the lecturers that come along, it's just great. I usually try and do a bit of paperwork in it, and I find it so difficult not to, when the questions are being answered, so I just sit in the corner and I just sit on my tongue and then just and just do some work. But listening to them interacting with the great speakers that I get to invite along. We had one, you both know him, Ashton Palmer. Who,
Yeah.
Yeah, and he just had, you could see he had so much information to give them. It was just it was just amazing. He was just showing them a lot of his again, protocol led, and a lot of his sort of like tips and stuff like that, and not ways of cutting corners, but ways just that are just effective, and protocols that he's learned of other people like John Coyce and stuff like that. It was just and I get to sit there and listen to it myself, and then take it back to my stuff. So yeah,
What's
it's
awesome
fabulous.
is the humility with which you're approaching all of this, because like you said, you've been doing what you do for 20 years, and you don't walk into rooms and go, well, I know all of this and I'm the authority. You're coming in curious, and I love that. And I really hope that I retain my curiosity.
Oh, it's great. There's so much more. Yeah, there's too much that you could learn in a practicing lifetime.
Yeah.
There's so much. So yeah, just sitting there and him talking about his secondary impression technique, I was like, I'm adding that. I'm going to use that. I'd never seen, where he was talking about occlusion paste, to create the peripheral seal. It sets quite quickly, and you can insert border molding instead of a green stick. I thought, that's just genius. I love that.
Can we edit this out? Because if Aston hears this, no, he's a brilliant clinician, but he's also a very good educator, and I don't think everyone realizes those are two different things. And actually, it's a gift when you have people like Aston, or I'm sure I've heard things about Mike being like that as well. Mike Gray, like these guys are really good at what they do, but then they're really good at passing it on, and they're really generous with it as well.
And the biggest thing you notice with all of these, and say with like Jazz when he was down, is the enthusiasm that they have. So when delegates sit there, what they see is they go, this person gets so much joy out of what they do. They're so enthusiastic. I want that. I want to be able to really enjoy, because who wants to do a job that you're not going to enjoy?
Yeah.
So they think, I want to do it. Well, if this is what they're doing, the way that they're working, and they get this joy from it, well, maybe that's what I want to do. It's like a subspeciality in itself. Just put your heart and soul into it, and be enthusiastic, because people love that, and that's what they want. Yeah.
That passion is just infectious. But you definitely have that as well as a teacher from your courses.
Great. It's something I just really love doing it. It's never worked a day in my life.
No, amazing. Well, thank you so much. We've got one last little bit to do, which is the dental quickfire quiz. That will.
Oh, can I ask Dave
Yes.
a question and put him on the spot before the quiz? Dave, sorry, I know you haven't had time to prepare this, but I'd really like to know, and I didn't have this question prepared, but speaking to you has made me think about it. Because you're the type of person that I think a lot of us, if we can feel like you do about work 20 years in, we win. So the question is there one piece of advice or one bit of information that you wish you had at the beginning of your career that might have changed things, even though you're very happy now? Is there one piece of information you've picked up along the way that if you knew at the beginning, things would have been done a little bit differently?
I don't know. So you asked for one thing. I instantly can think of two.
Great.
But if I was to pick out of the two of them, it's finding a mentor. Finding a mentor. That was the thing. When the biggest changes have occurred in my practicing life for the positive, it's always been because I've had the right sort of mentor. And I'd say one of the biggest ones within community for me was, again, David Davis. It was just, he led by example. If he was setting up a service, he wouldn't just go, right, we're setting up this service and put you into it. He would go into it himself. Yeah, we set up a mobile dental service in a forensic mental health clinic. He set it up himself, and then you'd go in with him, you'd do it with him, and then he'd hand it over to you. But he was always there in the background. Yeah, anyone who ever had the pleasure of working with David would completely agree with that. So I think if I would say one thing, having a mentor.
I love that.
There's one thing I say to any of the DF groups, any groups that I get the privilege of speaking to, that when you qualify, it's like as a dentist, it's like being given an expensive piece of marble, and it's lovely and it's beautiful and it's expensive, and you can just keep it as it is, and then at the end of your career, it's worth money. But if you gently chisel away at it and just pick away at it, and what I'm chiseling away at and what Flo and you are chiseling away at, because we all work differently, it becomes something that you've sculpted it, because that piece of marble, that's your dental career. So, with the CPD that you do, the mentors that you find, the way that you practice, where you go, and what you choose to do, that's you chiseling away at it, which makes it more beautiful to you. It may not be to someone else. What I've chiseled out may not work for you. But yeah, so it's about putting the effort in, because when you put the effort in, that's when it pays out. So just work at it. It's your career. You can it's only who's really gonna guide you along that way.
I love that. Thank you.
No worries.
So we're going to do the dental quickfire quiz that we're going to ask all our guests to enter. Earn your dental pearl.
Oh, okay. I thought this might be like a Viva.
So, which is your favourite procedure to do?
Procedure. It's not something specifically surgical. It's no matter what I'm doing, but it's a specific type of patient, and I've had quite a few of these. They'll come in, say maybe a 40-year-old child, absolutely in tears, red eyes and stuff like that. Never had sedation before, even though I've done an assessment and I've laid down my the ground rules that I do. It is it's that fear, because it's the day of doing something, and just saying, look, you may think because you're crying, but I often say, look, it lets me know you're in the right place, you're with the right people, and we've got the right stuff here. So and we start off on the sedation, and it's step-by-step approach, see how they get on. And then, I had one recently, and, I'd never had this before, but she thought that the drill was like, it was playing music. So I asked the Siri of my phone to start playing some music, and she requested, despite being 12, she wanted Peppa Pig. So off we went. So it's more that sort of, just that conversion from the untreatable to the treatable, that first positive experience. It's a delight to be that part of a patient's journey.
Amazing. Which is your favourite scrub colour to wear?
Well, obviously light blue.
No.
and monogrammed. You have to have
Love it. Do all your scrubs have Dave the Dentist on
Yep.
it? Love that.
All of them do.
I love that. With no context, which is your favourite tooth?
Upper left 6.
I love that. And if you were...
By the way, we've spoken to Dave about this before, and he still won't tell us why. And I know it's with no context, but this is gonna eat me up. One day you have to tell me, Dave. One day before I retire.
At the end, maybe when it's stop. But the upper left 6. Yeah, it's just. I think it's because if it was the right 6, it's not as comfortable as the left. And I like the cusp of carabelli, and then it's just it's a complex tooth for extraction, and it's just low. But it's over that side, so it's a little bit more comfortable.
I like it.
What I love is that every dentist does have a favourite tooth.
I don't think I have a favourite tooth.
Oh,
What's your
it'll come
favourite
to-
tooth?
Oh, it's an upper left 4.
Upper left. You guys even have a side?
For comfort.
But it's because you're like ambidextrous.
I have I know what it is, because I don't deal with teeth. I have favourite implants, but I don't have favourite teeth. Okay, I get it. Okay.
And if you were just leaving dental school now, which area would you specialise in?
Yeah, it would have to be paediatric dentistry. It would always be paediatric dentistry. It's just, they're just forever changing, forever evolving. They're just so fun. I had a consultation with a 4-year-old this week, and he wanted to talk about dinosaurs. So I'm chatting with his mum. He wants to talk about dinosaurs. So I'm having a conversation with him about dinosaurs and a conversation with mum about the reason for the referral. He did not care what we wanted to. He wanted to talk about dinosaurs. So it was good. They're just so fun. And it just, if you get it done if you do it right, then you create someone who, for their lifetime, will hopefully, if it's done well, won't grow any more holes. Because often I'm only really seeing patients who need treatment.
Yeah.
So hopefully, if you've got the prevention right, they won't need any more doing. And then, if they do need something doing in the future, hopefully you've created this patient who will hopefully sit in the chair, have a simple, local anaesthetic injection, and have a simple filling, maybe, an extraction, something like that. If I've done it right, hopefully. But last thing, what I don't want to do is have them so that they're just solely reliant on me.
Yeah.
Because I've got to retire at some point. They've got to be able to
faith in
to
the
go on to-
profession.
Retire and return again.
Yeah. I don't think I'll ever stop. It's just so fun. It is so fun.
Can I ask, do you think that clinicians, by specializing, can help more people? Do you think it makes a difference in the work that you're doing to be a specialist or not be a specialist?
Well, I got into community dentistry and seeing some special care patients before special care dentistry was a recognised speciality. That doesn't mean that people weren't already doing it and working at that level. I think that there's certain things that are very complex, and it does help having that additional training, those additional skills. Yeah, especially when it comes to sort of like endodontics and stuff like that, and then those who are working within oral cancer and stuff like that. So I think there's a place for everyone. We're not in separate silos, and we all work together. Yeah. So I don't think there's an argument for not having specialists or for having specialists. I think we all work together because
There's a part for everyone.
Yeah, I like being a generalist, but I get to do general dentistry on a very specific group of patients. But then this week, I could have done a whole week of just doing chrome dentures if they were all like this. I could, and it was always a thing when I went into kids dentistry. I thought it's because I'm trying to avoid partial dentures, but no, it was just it's all. I'd never want to give up any one thing, so that's the nice thing about being a generalist. But if that's what you're doing, to chisel away at your bit of marble to make it, as long as you're happy, then you're going to be doing the best sort of work that you can do. You are the best you, and if you're doing that, then that's great for your patients. But we can't all be implant surgeons. We can't.
And we can't all be helping people have that experience. It's amazing. Yeah, I have to say, this has given me a very different perception of a special care and community. Dave, amazing. Really cool.
It's a really rewarding job. It is great, and we get to work with. And it's not just us, because I always say, to parents and stuff like that, that if you think I'm good, I'm not. I'm only 50% as good as you think I am, because the other 50% is stood in the room next to me. Our nurses are phenomenal, and luckily there are additional courses they can do in sedation and special care dentistry, pediatric dentistry, but they're just naturally, by coming into our service, there's those sort of people that enjoy that sort of work. So wouldn't be able to do it without the rest of the team, our anaesthetists, and then sometimes with more complex patients where we might be liaising as a part of an MDT. This is something more our consultants get to do with adults who require treatment under general anaesthetic, but often being able to deliver that general anaesthetic, to get them off sleep can be the tricky thing. So often speech and language therapists, play therapists, the carers, of these adults with additional needs. It's listening to all of their voices. So it's very good. I went out to see a patient once who with additional needs, who needed a tooth out, but prior to that, to get him so that we know that he would open his mouth to me to have a look in with a mirror, the speech and language therapist had suggested that the nurses just getting him to open with a spoon and then pretend that it was a mirror. So so there was a lot of prep work there. So it was very good for them thinking outside the box. It's so we're part of a wider team sometimes, and it's great working within that.
That's amazing. No, thank you so much for giving up your time today. It has been really educational and also very motivational.
Yeah, I agree.
But I'm going to go and chisel some marble now.
Yeah. No, thank you, Dave.
Thank
Brilliant.
you.
Really good.
Thanks for the invite.
Ali, why did you invest in the Navident dynamic navigation system?
It's incredible. It brings our safety and accuracy up for patients. Here's a tracker that we use, and thanks to Rob from the Dental Imaging Company, it's been great support and so easy to set up. I see why so many people go to him for their digital imaging, 3D or two-dimensional, and also all their surgical supplies like Ustamed screws. Rob's been incredible, and I'd highly recommend working with him.
Ali, can you name everything in the practice that's made by W&H?
Ooh, off the top of my head, all of our handpieces, our sterilization equipment, my implant motor, the PiezoMed, they're an incredible company to work with because they're an Austrian company that focus on hygiene, and we know from studies that patients care most about hygiene. To top it all off, the support we get from them is amazing. They don't actually supply the equipment, but they provide the support. Now that's true support. Crown Dental burrs have a rota system, and what that means is I have the same burr box every time with the same burrs numbered. I ask my nurse for the number of burr rather than having to remember the name of it. And it also means that when I need a new burr, we go to the box which has this card, and if we are running out, my nurse can just scan the QR code and order the same one. So we never have problems with inconsistencies with burr boxes or burrs. Thank you very much for implementing this for me, Paul. I love it. And the other thing I love is that Paul's a problem solver. So I worked with him to curate this alveoplasty set, which he has such great knowledge for all of his burrs. And it means that we have everything we need for full arch surgery. So whether you have a problem with your set and need this set, or you have a problem that you need help solving, Crown Dental Burrs will help you do it.